Emergency services. Okay, tell me exactly what happened.
So I just walked past the public toilets and it looks like there's a guy overdosed.
Do you know what he's taken?
He's had heroin.
How old is he?
I'd say probably early 20s.
And is he breathing normally?
It's quite shallow.
All right, we're just got to quickly test it together. So I want you to say now, every single time he takes a breath in, starting immediately.
I feel like he's... Oh, now?
Yeah, and again. Has he taken another breath? Sir, has he taken another breath in at all?
No.
All right, now an ambulance is being sent. Is there a defibrillator available?
No, there isn't.
Okay, listen carefully and I'll tell you how to do resuscitations, okay? So you've got him flat on his back?
Yep.
Mike 30 received.
For intensive care paramedics Simon and Michaela, it's an all too common call.
So, Simon, we're going to a patient who might have taken an overdose. How many drug overdoses have you been to over the years? I can't even count how many.
Hundreds.
Pretty sad. People who are in their 20s, it's usually party drugs. It's not heroin.
Yeah.
Heroin has a number of effects on the body. The main one is respiratory depression, meaning that the patient might be breathing inadequately or not breathing at all. And eventually, the lack of oxygen will cause brain damage, but will also cause their heart to completely stop.
Oh, they're ventilating him.
Another ambulance crew and the fire brigade arrived only minutes earlier.
I'm not even sure what his name is.
Yeah.
But basically, he's gone into the toilet, ingested heroin of an unknown amount.
Yeah.
He's come out unconscious.
Yeah.
On arrival, GCS 3, rest rate of 4.
A GCS of 3 means the patient's heavily unconscious and a normal respiratory rate is between 12 and 16. So a respiratory rate of 4 is grossly inadequate in delivering the oxygen the brain needs.
I'll just help you there. Really lift his jaw and I'll ventilate.
Essentially, if the patient wasn't being ventilated, his brain would be dead within 10 minutes.
We've got a good blood pressure, 120 on 80.
Yep.
Heart rate's 100, sats 100%.
Yep.
We've got a rest rate inherent of 4, so we're just supplementing him here.
Simon, Michaela, and another paramedic crew, Emma and Georgia, are urgently treating a man who is overdosed on heroin.
I'll ventilate.
It's made him unconscious and slowed his breathing to a life-threatening low rate.
Well, let's have a good look. There's no other injuries on him. Simon can drop some naloxone. Yeah.
Initially, we address life threats, so airway, breathing, circulation, and then once the oxygen levels are restored, we administer naloxone, the drug that reverses the effects of the heroin.
I'll show you. Hold the mask like that, and then you lift the jaw up with your little finger.
It's critically important that we normalise the patient's oxygen levels because it'll stop further brain damage. But also, when they wake up, if their oxygen levels are low, they can wake up agitated and can be violent.
Now he's just take a breath then, so now have a go. You got to get right in there.
Right
but
up.
Keep practicing, because it's really good practice for you. So if your waveform kind of goes, it means that your seal's not there.
Yeah.
One of the paramedics on scene is a graduate, meaning that it's her first year on the job. So it's a really good opportunity to run through some techniques and some skills with her at the same time of managing the patient to build her confidence, because we do know that she's going to go to a lot more overdoses and unconscious patients in the future.
So I think, girls, we've been ventilating him long enough. He's not hypoxic, so he shouldn't wake up agitated or anything like that.
Yeah.
So have you given an IM before?
Once, yeah.
Do you want to give this?
Yeah, sure.
Yep. All right.
This is a great opportunity to empower the young paramedics. So with critically important skills, basically our intervention can be the difference between life and death for this patient. So 5 mils, which is 200 milligrams. So what you do is 2 fingers, so from his hip down, and from his, well, he's got quite a long knee, but this is your space here. So, yep, that's fine. He's quite thin, so you might hit the bone when you go in, so, yeah.
So we'll just note the time.
Naloxone usually takes 1 to 3 minutes to work, but my worry for this patient is that the naloxone going in won't make a difference because his brain's been starved of oxygen for far too long. So he might have already had a brain injury by now. Or worst case scenario, he may never wake up.
So in the next couple of minutes, we might see that he starts to improve his conscious state. Yep.
Simon and Michaela wait for medication to work that will hopefully reverse the effect of their patient's heroin overdose, so he can regain his consciousness and start breathing unaided.
So there's two ways you can hold. You can do like a C grip like this, or you can do like this one.
It's a case junior paramedic Emma will have to get used to, with 1 to 2 people dying every day from opioid abuse in Australia.
Do you want to have a go from where I am?
Yeah,
You have a go.
Hands-on and on-the-job experience is priceless for paramedics. It's the best way to gain confidence and gain competence in the skills you're performing on a day-to-day basis.
Open your eyes. Can you hear us?
Naloxone takes 1 to 3 minutes to work. It's a nervous time because there is a chance he could wake up combative and put himself and us at risk. And we don't know whether he's incurred any brain damage. I just hope he's going to live. I find it sad when I'm ventilating a 20-year-old, but it's much worse when I arrive and they're dead.
So in terms of like him going to hospital, he's had some CPR done.
Yeah.
So it's always advisable that they go.
Yeah.
Usually they decline and refuse and say no. We'll try and get him seen, especially because he's been unconscious for quite a period of time as well, and he's a flat GCS3.
Yes.
Because he's had CPR, he could have rib fractures. But following an overdose, these patients, they generally don't want to go to hospital because they're embarrassed and they may not want family or friends to know they're using drugs.
Can you wake up? There you go. Hello. Wake up. It's okay. It's okay. It's the ambulance. Everything's okay. It's okay. You're not in trouble. Everything's all right. It's the ambulance. Sit up. Just wait.
We're fortunate this patient hasn't woken up aggressive. These scenes can be quite scary for us as paramedics, so it's really good that he's just a nice guy that needs help.
Hold on. Just be careful. Don't rush yourself up.
There we go.
Can we take you to the hospital? Yeah. You've had some CPR done on your chest.
It's a great relief that he said yes to going to hospital. This means that they can monitor him for rib fractures, but more importantly, he could get some drug counselling.
Just take a seat on the bed. Go sit on the bed.
And we'll cover up. We'll cover up.
Oh.
Yeah, you got to sit
Can
right
you
up.
turn that-
You got to sit
you
right
can
up.
turn that inside out.
Yeah.
It's all
Wiggle your
inside
bottom.
out.
He's clearly coming to terms with the gravity of the situation. He's cold, he's scared, and he's just had a near-death experience.
I really hope that today's a wake-up call and from here, he gets the help that he needs.
I'll leave you with it.
Yeah,
thanks. Cool.
It's a sad reality that if no one had come across this man, he eventually would have stopped breathing, his heart would have stopped beating, and he would have passed away.
Bye.
Thanks for your help.
Look after
See ya.
yourself.